All right, so if you're having an ankle fracture surgery, I'm gonna talk to you about everything you need to know about your upcoming surgery. So if you have an ankle fracture, you might have a variety of this. This is an example of a medial malleolar fracture and a fibula fracture. This is what we call a bimalleolar ankle fracture. And someone like this, and maybe like you, will need surgery because this bone, the talus, is drifting over this way. And really, in order to stabilize the ankle, this needs to be fixated on the outside and this needs to be fixated on the inside. So what does that look like? And we'll run through that real quick. Typically, it looks like some temporary fixation with a wire, followed by a plate and screws on the outside and screws on the inside. So you go from having the talus moved out to now having everything centrally and nice and stable. So now, what do you need to know about your surgery and preparing for your surgery? Essentially, when you have the surgery itself, a lot of times we'll give numbing medication for your pain after. Sometimes that looks like a popliteal nerve block, where the anesthesiologist will talk to you about you getting a popliteal nerve block after the surgery. Sometimes I'll administer local anesthesia directly after, so you'll have some numbing medication for about 4 hours, but the popliteal nerve block does give you pain relief a little bit longer than that. Other than that, there are obviously risks with anesthesia, but really, as long as you're healthy and we get the appropriate preoperative lab work, those risks are mitigated. So make sure you get your preoperative lab work that we go over with you before surgery. Make sure you talk to a medical doctor and get medical clearance for surgery. The next thing you have to do is, when you wake up from surgery, you'll be in a splint. That splint will stay on for about 2 weeks until I see you back. Don't remove it. Don't get it wet. You'll have to get a cast bag or a shower bag to make sure that that cast stays completely dry. You don't want to try to really take anything off because everything on the inside was put in the sterile environment, so we want it nice and clean. Now, other than the risks with anesthesia, which the anesthesiologist will talk to you about, there is a risk that if you don't move your knee, you can develop what's called a blood clot. So I want you to make sure that even though you can't put weight on your leg, that you move your knee around and you kind of do some light pumping, and you can move around as much as you want as long as you don't put any weight on it. So you can keep it elevated for a period of time, you can put it down, you can have it on the couch, you can move around on your knee scooter, you can do all those things. So typically after a fracture like this, you have to be off your foot for about 4 weeks. So I see you back in about 2 weeks. I take the stitches out at that time. I switch you into a boot. That way you can start to move your ankle back and forth, and usually we'll start you with physical therapy at the 2-week mark. During that period of time, in between the 2nd and 4th week, you still have to keep your foot off the ground. You still have to make sure you don't put any weight on it. So for the first 2 weeks, you're completely off of it and in a splint. Then I see you in the office at 2 weeks. The sutures are removed. You go into a boot. You start physical therapy. At 4 weeks after surgery, you can start to put some weight on your leg. So that means that you can start to put about 50% of the weight on your hands, about 50% of the weight on your foot, and slowly start to increase how much weight you're putting on your foot. At about the 6-week mark, usually people are nice and comfortable. Maybe they're using one crutch, maybe they're using no crutches, maybe they're using a cane, but they're feeling pretty good moving around, just walking in the boot. At about the 8-week and sometimes the 10-week mark, most people are okay to come out of the boot and switch into an ankle brace. And we'll show you how to put that on here at the office. The next thing is progressing your physical therapy. The first several weeks, that first kind of 4 to 6 week mark, until you're full weight bearing in the boot and ready to transition into an ankle brace, you're really just working on strength. The first 2 weeks are non-weight bearing strength, working on bands, range of motion, and then progressing into some more stationary balancing exercises on one foot, doing some stationary squatting exercises, and then progressing into things that are more dynamic, such as side step squats, back step lunges, forward step lunges, and things of that nature. For the most part, this sums up what to expect. You're going to have anesthesia. If you're healthy enough, the risks with anesthesia are mitigated. The risks with surgery really lie around that kind of initial 2-week period. I'm going to give you pain medication and antibiotics to make sure that there's no risk of infection. Also, make sure you move your leg. We don't want you to get a blood clot. Next, as long as you keep things nice and dry and that incision is nice and clean, I see you after and I'll kind of guide you through everything again on your own at your visit. If you have any questions, please don't hesitate to call us. Let me know if you have any questions. Otherwise, speedy recovery.